We want to welcome Dr. Michelle Jorgensen out to the podcast again. We're so blessed to be able to have her on here for the second time. And she is a pioneer in so many different ways. And since we've had her on last time, there's been more things that she's actually has been able to improve on and be able to teach so many other people. And so
obviously
thank you.
Brought new things to the clinic and things of that nature.
So now Dr. Michelle Jorgensen, she is an internationally acclaimed author and speaker and teacher. She's a biological holistic dentist and health and wellness provider, and she is an author of 4 different books. That's amazing. So you're going to definitely be able to learn a lot from her today. So Michelle, do you want to kind of tell us a little bit about you and your journey and how that you got here?
Yeah, I'd love to. Thanks so much for having me on. I really appreciate you both and all that you do. Last time I was on, I shared my story, but I think it's always useful to do that again, just because those who hadn't listened to the other one. So, I'm a general dentist.
I've been on a hiatus with COVID
everybody's been on a hiatus. The world's been on a hiatus, I'm afraid. Yes. So, I'm a general dentist. I've been practicing for a long time, 25 years now. And about half.
Be careful when you say that, because then you sound old, because that's how I am. And I feel old.
I know. Actually, though, sometimes I feel like being old is an okay thing, because it means that you have a few years under your belt and you've learned a few things, and that's definitely my experience. About halfway.
You look much better than me, so I'll just tell you.
Well, thank you.
A lot less gray hairs, right?
Hey.
Yep. Well, halfway through my career, I started having all sorts of health issues, and that's what probably a lot of people on this are listening to are faced with as well. And some of those challenges, it didn't make a lot of sense. I had a lot of numbness, a lot of gut issues. I wasn't remembering anything, and that's just very unlike me. So I finally, through a lot of research, found that it was mercury poisoning, and I didn't expect that, didn't know anything about that.
And you were never informed on that stuff in dentistry, right?
Oh no, they still don't. No, you ask 9 out of 10 dentists today won't tell you that that's a problem.
It's crazy. Liz, when I was in chiropractic school, she was a dental assistant. She remembers going back in the back room and mixing up the mercury fillings, just mixing it up in open space. It's just insane.
Yeah, you would never use mercury.
I feel like that is what kind of started my progression of the things
health issues as well.
Health issues, what is actually, I guess, is kind of a blessing, because that's why we're here right now, just like with you.
Exactly. Yep.
That's why you're here right now.
Sorry, I didn't mean to cut you off there, but
no, we have our own challenges, so we can teach other people too. And that's really the truth with dentistry. Dentists don't know it, and just the public at large doesn't know. The mercury that I was exposed to that caused all these problems was from dental fillings. So mercury, the dental fillings that we call silver fillings or amalgam fillings, are 50% mercury. So when you're placing them, that's a problem, obviously. And there's a lot of dentists that don't place them anymore. So that's good. They're not banned. They still are placed in the US every single day. But there are a lot of dentists who've chosen not to place them anymore. However, that's actually not the most dangerous time. The most dangerous time is when they're removed, because when they're removed, then it causes that mercury to turn into a gas form, a vapor form, and it's in the air and everybody's breathing it in. And that's what was making me sick, because I was drilling them out every single day, all day long.
And you were just breathing it right along with the patient, right?
Yeah. So, it's dangerous for the patient, obviously, but they're only getting their own. I was getting everyone's. I was getting every single patient that I was drilling. So it was literally killing my brains, killing my nerves, killing my gut. It was just crazy. So I had to find, was there a way to do it differently? And there is. And that's what I have found, is that you can safely remove these fillings, but it has to be very intentional. We use a lot of additional steps, and the patient uses a lot of additional steps, and it's important to do, but it has to be done the right way.
And that is for sure. That is for sure. If someone's going to get their fillings removed, make sure you go to a biological dentist.
Absolutely.
A lot of people don't even know what a biological dentist is. And the sad thing is, dentists don't even know what a biological dentist is.
No, they just think I'm insane. They just think I'm crazy. I'm like, well, you might think I'm crazy.
You're wearing a hazmat suit to take out those fillings.
Yeah, why in the world would you do that?
The gas masks and all that kind of stuff. I know, because I got mine switched out, because I was like, you know what? I'm struggling with my health. I need to figure out more. And so I did go in and get.
Yeah, you've had them out for what, 3 or 4 years now?
Yeah, I got everything taken out and switched around, and hopefully it can help me for future things that can also bring. So
Exactly. So it's important. And, you know, that's really where I started was the mercury piece, because that was my issue. That was my health challenge. So that's where I started. And then I started having other practitioners, patients alike say, hey, if you do this, do you do this too?
Right.
And I didn't have a clue what they were talking about. So I'd have to go learn.
Microbiome. What do you mean?
Yeah, I don't know what that means. So I'd have to go find courses wherever and learn. And at that time, it was quite obscure. You know, I was going all over the place and nobody was really doing this in a concise manner. And anyway, put together a whole bunch of things that are really focused on the health of the body in general, not just the mouth. And that's changed my practice entirely. And it's changed the way I look at people. It's changed the way that we help people and care for people now. And thankfully, it is becoming more of a thing, you know, more people are learning about it. And I've created a multi-specialty practice now where it's a place that you come and you get everything done from, you know, everything that has to do with the mouth and the airway, you know, and breathing and sleeping and kids now we take care of there as well, because people have just continued asking. They said, boy, this is great. Can't you do this for my kids? Or boy, do you know anything about this sleeping thing I've been hearing about? And so we brought everybody under one roof. And that's what's really fun about what we're doing now, is that we're able to help people kind of start to finish in this journey that they're doing.
And this is something new that you've been on since the last time we talked. So this will be kind of fun.
Yeah, so that's what we want to focus on with you today, is what we've talked about is what are you doing with kids? This whole, how can it affect a lot of other things that they're having, a lot of other issues they're having? So what got you started into the kid thing, and what was the first things that you started noticing and why?
So what got started in the kids thing was simply demand. Every single day of the week, people would say, do you see kids? Do you see kids? Do you see kids? And, you know, we'd say, well, we don't, I'm sorry, we're not really equipped for that. Well, where should we go? We didn't have an answer. We didn't have anybody. In fact, we had a great office that we thought, you know, it was as close as we could find, you know, near us. And they actually called us and said, will you quit sending patients to us? They ask us things that we don't do.
Wow.
And I said, well, okay, I don't know that I've ever had someone.
Was it a pediatric dentist? Was it a pediatric dentist that you said?
It was a pediatric dentist. Yeah. They called and they said, please don't send us patients anymore. So
we don't want to answer questions we don't know anything about.
Exactly right. So we said, you know what, we better figure out how to do this. So thankfully, at the same time, I had a dentist join me. We've since partnered. Her name's Lindy Jones, Dr. Lindy Jones. And she's a young mom herself. You know, she has a 4-year-old herself. So she's very much in the trenches as a mom and knows what moms are looking for when looking for care. So we have worked with dentists across the country to really find out what should we do for kids? What is different about kids than it shows up in adults? And there are some things that are different. And so we've really fine-tuned the procedures we do for an adult and have focused on how do we take care of kids, number one, preventatively, so that they never turn out like their parents. You know, their parents are in my office and they're spending thousands, tens of thousands of dollars to repair and reconstruct what they had. Well, wouldn't it be great if the kid never had to do that? You know, if we could prevent all of it before it even started. So a huge focus in our pediatric practice is prevention. And we talk all day long, every day with parents about how do you prevent tooth decay? And it goes well beyond what everyone's been told. Because what have you been told?
So let's kind of talk about that, because you know, people, I mean, a pediatric dentist, that's kind of what they would say, right? This is a regular pediatric dentist. So being a biological, I guess, pediatric dentist, what would be different from what you're saying versus what a regular pediatric dentist is doing?
Well, what's the regular dentist going to tell you? What are they going to say causes cavities?
They're going to say sugar, but they're going to also say they need fluoride.
Yeah, they're going to say sugar, lack of fluoride, and brushing your teeth.
Right. Yeah.
Right? That's it.
Yeah.
Brushing your teeth, fluoride, and sugar.
And maybe sometimes if you overdo lemons. Because I have a dark kid.
I don't know. That might be a little out there, but yeah, you know. So they're gonna.
No, we had a kid that just would not stop eating lemons, and I think he trashed his teeth because he went in and had way too many cavities.
Oh yeah. It definitely.
I think that's what it was from. Because he ate very healthy and stuff like that. So yeah, he just would pound them, and I think he just ruined his teeth a little bit from it. But wow. Sorry for the side note there.
Yeah. So that's what they're going to tell you. Unfortunately, that doesn't always explain it. I mean, I remember growing up, I had a brother who didn't brush his teeth, I'm pretty sure from like age 8 to about age 15, till he started caring about girls. You know, I mean, they were just disgusting. You know what I'm talking about.
Yeah.
He never had a cavity.
Yeah.
So if it's all about brushing your teeth, so like he should have had a mouthful, right? And then I'll see other children who are great at taking care of the teeth, and the teeth are, you know, sparkly clean. There's nothing on them anywhere. Parents are super conscientious about sugar, and they've got a mouthful of cavities. So
it's always frustrating and crazy. Yeah.
Exactly, because if those are the only answers, then the parent just must be bad, right? And that's usually what we get to is, oh, it just comes down to parent guilt.
Yeah,
It just
I know, because I've taken many of my kids in, and there is that parent guilt.
Totally, 100%.
And it's like I was a dental assistant, and what, I can't keep up on their teeth.
And she still won't go to bed until she flosses every night.
Yeah, 100%. And so you're just taking it on yourself. Oh, this must be my issue. Well, we talk about some other things. So first of all, from a prevention standpoint, a huge piece of this is gut related. And how many people in our world, you know, you guys, I'm sure talk about this all the time. How many people have gut issues, and kids are not left out of this? And the reasons are environmental. It's the food we eat. It's the stressful world that we live in. It's the environmental toxins that we have, including Wi-Fi and cellular frequencies and things that we're bombarded with that are pushing our bodies into a very stress-filled mode. When we're in that stress mode, the body stops creating stomach acid. And when it stops creating stomach acid, it stops absorbing nutrients. Well, guess what the teeth are? They are a bank of nutrients, of minerals. So
and your first line of defense in the gut microbiome that people don't even think about.
Absolutely.
Right? Your mouth is the first place where the microbiome starts to,
where everything lives. So if you've upset the microbiome in the gut in general, then you've now changed the microbiome in the mouth as well. So the body will look for nutrients wherever it can find them. And if it cannot get them through food because the gut isn't functioning properly, it will pull them from teeth. And that's where we see cavities showing up in kiddos, is when they have nutritional deficiencies. And usually when I say nutritional deficiencies, mom automatically go to the guilt place again. Oh, I'm just feeding them poorly. No, I'm not talking about that. I mean, it may be that there's, you know, more that needs to go in.
Isn't okay.
Yeah, you know, maybe not. But it's also nutrition from the standpoint of, are they able to pull nutrients out of their food?
Right.
And often the answer is no. And so we have a great test that we do, that we have kids, everybody loves to do this one. What you do is you take a 1/4 teaspoon baking soda and a cup of water, you drink it, and then you time to see how long it takes you to burp. And all you're doing is a science fair experiment. You're adding baking soda to the vinegar, in essence, in your gut, the acid in your gut, and it should cause an eruption, which is a burp. Right. So of course, kids love this, because you're going to say, okay, we're going to see how long it takes. And you're going to do it. Exactly. I mean, what kid isn't going to love this? Right. So you want to be burping in 2 to 3 minutes. If you're not burping in 2 to 3 minutes, it means you have inadequate stomach acid, and you are not going to be able to pull the nutrients that you need out of your food. So this is just a starting place that we tell parents all the time. Hey, let's just make sure that their gut's working properly. Because if
like, what is the longest you've seen when kids have done that?
And I want to step back.
Never. This is for adults and kids too. This is the whole family. Everybody should be doing this.
Well, 2 to 3 minutes seems really long. So a lot of times if you drink something, you'll belch within just a couple of seconds.
Hopefully.
Yeah. So
hopefully. No, we have multiple people a day who don't burp at all.
Oh, really?
Yep.
That is kind of interesting.
Wow.
Yep. So that just tells us, because the way the body works, I know you know this, but you know, there's sympathetic and parasympathetic. Those are the two ways that the body's operating systems. It's kind of like the computer has an operating system, so does our body. And the one is the stress reaction, the fight or flight. It's defending itself against something, or running away, or, you know, it's fearful, versus I'm resting and refreshing. Well, the things that we live with, just literally like Wi-Fi, the environmental things we breathe in the air, the things we're eating in our food, all of these things put our body in a very defense mode, in that fight or flight place. Well, when you're in the fight or flight, your body stops creating stomach acid. I tell people all the time, if you're running away from a bear, the last thing your body needs to be able to do is digest food. It needs to be able to run. It needs to be able to scream. It needs to be able to, you know, whatever. It doesn't need to digest. So your body stops digesting when it's in this fight or flight mode. Well, I'm finding adults and kids alike are in that mode a lot. I'm going to talk about something else that pushes us there too, but kids are there a lot, and it just stops our stomachs from working right. So instead of digesting food properly, the food goes through the other side, the nutrients don't get extracted. So the body has to find them somewhere. So I tell people, if you're getting cavities in your teeth, you're also getting cavities in your bone. It's the same thing. So this is a really good wake-up call. If you're getting cavities, your bones look the same. So you need to think, what's happening? Am I not eating enough nutrients? Am I not absorbing enough nutrients? How do I add them back in? So that's the second step that we talked about with parents. Not only, just from a prevention standpoint, how do you make sure your gut's working and you're getting the right food? And the right food is fat soluble vitamins. So people don't understand this. They think, oh gosh, I should be vegetarian or vegan or, a lot of these things. Well, that's fine. But you need to understand that fat soluble vitamins are the vitamins that actually put minerals in cells. I like to think of them as the key that opens the cell and pushes the mineral in. Right. So if you don't have them, these are vitamins A, D, E, and K. Those are the fat soluble ones. And I call them fat soluble because they're found in fats. Right. So if you're not eating fats, you're not getting these vitamins and you're not going to be building teeth and bones. Simple as it is. Wow. So if you're vegan, vegetarian, if you have a diet that is minimal on animal products that have animal fats, then you're going to be very deficient in these things. And I find some of the worst teeth in people who are trying the hardest for their food, their diet. And because they don't understand.
Right. It's not easy to eat that way, I mean,
no, it's hard
for sure, but it's not easy for sure.
It's hard. So I tell people butter. I want you to use butter that has vitamin K, vitamin D in it, Kerrygold butter. No kid ever complained when their mom said, we're going to start eating more butter.
And coconut oil, I don't know. Does coconut oil have all that stuff in it too?
No, coconut is plant. It's not animal based.
You need to get the animal.
You have to have it from an animal based source. That's the tricky part. So if you're completely non-animal based whatsoever, that's why I would recommend butter, because a lot of people will say, I'll do butter. Right. I'll do butter. If I really don't want to do animal products, I'll do butter. Mm-hmm. Fermented dairy is a fabulous way to go. So a kefir, goat's milk, something like that is a really nice way to go. It's very difficult to get it from only plant sources. There are a few, but it's really hard. So you have to be very intentional about it. So we talk to parents about
with supplements well enough with if they're doing it that way or not. Do you not think so?
And that is the only way really to balance it out. To balance out leaving it completely out of a diet, that's the only way. Is you're going to have to supplement not only vitamin D, but vitamin K. Those are the keys for teeth development. And it's vitamin K2. If whoever named it that, I really wish they hadn't, because everybody thinks of vitamin K1, which they say, oh, you get that from greens, you get that from spinach and kale, not vitamin K2. It's different. It's a different, it's a different vitamin entirely.
Vitamin.
Yeah, it should have been
vitamin G.
Vitamin G, vitamin something. Why vitamin K again? Because it screwed everybody up. So you do not find it in greens. It is only in animal products and primarily, and I'm not a huge, meat eater, but we do butter, we do kefir, we do, some of these things that can deliver the vitamins that we need. So that's really what we focus on from a diet standpoint. I mean, everybody knows not to eat sugar. That's a done deal.
Well, that's kind of a common question. If you ask somebody, what is it that you need to take out? They'll say sugar.
Sure. Everybody knows that. That's nothing new. That's nothing special here. But what do you add? Those are the things that you're going to add, or those fat soluble vitamins. And then how can you build up the teeth if they've already been lost? So let's go to the fluoride question. Everybody says, oh, you just need more fluoride. Well, I disagree, because
it's so funny because you look at the elements on the periodic table, and fluoride is one of those ones that's pretty toxic.
Yeah, well, and we'll talk about why it is. So the problem is that cavities are not a deficiency of fluoride.
Right.
Fluoride does not naturally exist in teeth. So when you have a cavity, it's not because you have too little fluoride. It's because you have too few minerals. So my preference is, why don't we add back the thing you lost, not the thing you never had? Mm-hmm. So let's rebuild a tooth with minerals. Let's not rebuild it with something the tooth never had. Now, what does fluoride do to a tooth? Fluoride actually changes the structure of the crystal in the enamel, and it actually makes it stronger. So it does make it more resistant. However, it also changes the crystal in bones and makes it more brittle. So research studies show more hip fractures, more other fractures in areas that have high fluoridation rates, because it's also changing your bones. Your bones are not deficient in fluoride, just like your teeth are not deficient in fluoride. There is no fluoride. It's changing the structure of the bone and the tooth. That's not what I want to do. The other thing fluoride does is, again, if you look out on the periodic table, it sits right next to iodine. It's called a halide. So it's like chlorine, iodine, bromine. They're all the same classification of element. Well, it will bully out iodine. Iodine is the key that initiates every cell that secretes something. So that's stomach acid, that's the thyroid, that's all of the hormone, adrenal glands, everything that secretes a hormone is impacted by iodine. Well,
See,
fluoride will
didn't
push.
know that. I mean, I've done a lot of thyroid care and stuff like that in the past, and I didn't know. I mean, I knew thyroid iodine was, was one of the issues with thyroid, but I didn't know it was because of the secreting of the hormone.
Yep, it's because of the secreting of the hormone. And so fluoride is a bully. It will bind on the same sites that iodine will bind on. And it will bind preferentially, meaning it will push iodine out and it will bind in its place. So if you have a lot of fluoride in the body, what's going to happen is the fluoride will bind in the place of iodine. And so you will get thyroid hormone that looks like it's been activated. On a blood test, it'll show you're fine. You have plenty of hormone, but it's not usable hormone.
It's not being able to get into the system.
Yep, it's been activated by fluoride, not iodine, so it won't work. So this is actually causing severe thyroid problems. Yeah. And sometimes it doesn't show up on a blood test.
I was going to tell you interesting story. I was born in Amarillo, Texas. My parents only lived outside of Utah for like 2 years, and I just happened to be born there. Well, my baby teeth, when I was a kid, my front 2 baby teeth had big divots, brown divots in the front of my teeth.
Fluoride.
And it was because there was so much fluoride in the water. But then I was always told, because I never got cavities, my parents always said, well, that's because we had so much fluoride in the water when you were.
And it's true. Remember, it makes a stronger crystal. It's true. But I wonder what your bones look like.
I know that is true. You can't fall. I'm not going to take care of it.
I really haven't had any broken bones, so I was able to get my other minerals in there.
We don't use fluoride anymore, do we?
Yeah. Yeah. So what do you do instead? So fluoride causes all sorts of other issues in the body. So there's no reason to add fluoride. It's not what the tooth is missing. We need to add minerals. So we add minerals through.
So what do you do with these parents then that now all of a sudden they're like, oh, wow, I've been giving my kids fluoride for a long time.
Well, they get them in their dentist's office, right?
Yeah. So what do they do? Like, is there a way for them to like overcome that and be able to, put in new practices and not have it affect their kids that way anymore?
You stop so that it doesn't affect, when minerals, bones turn over, our bones remake themselves about every year. Right. So that's good news. Is bones remake themselves about every single year. Teeth don't really do that as much, but bones do. So you stop and then you add minerals instead. So a couple of the ways that we add minerals and tell people is obviously through diet, like we've already talked about, but there's something called humic and fulvic acid. And it's basically, I don't like that it's called acid because everybody thinks it's acid. It's not, it's dirt. It's dirt water. That's the way I think of it, is it's just basically from the dirt. And so it's full of minerals. That's where minerals come from, is just the earth. Yeah. Mm-hmm. So it's just literally taking minerals in the form that nature provides it. So it's a supplement you can get. I like in a liquid form. It tastes like a penny's been sitting in water. There's a little bit of like a coppery tang to it, but almost no taste. So kids will do it. So the one I love is called The Gift from Mother Earth Labs. I get nothing from them. I just like them because it tastes like almost nothing, but it's a great mineral supplement. I also like
something they're pouring into water.
Is it a droplet?
Is it a droplet?
Nope, it's just you pour in about a teaspoon of it into a cup of water. The kids drink it down in the morning. We just set it out on the counter every morning. We set out a cup of water and pour a little teaspoon of this in, and everybody just drinks it down. So it's easy to take. The other one that's really easy for kids is cell salts. So cell salts are basically the homeopathic building blocks of cells and of the things that our cells all need. And there's the ones that you want. So Highland is the brand that makes cell salts. Okay. The ones that help with teeth are numbers 1, 2, and 12. Those are the ones that I recommend that will help build teeth. These are great for kids. They're great for pregnant women. They're great for nursing mamas. They're great for anybody, and they taste like nothing. They're just like,
you also 1, 2, and 12. What do you mean? They come in a product. It's
exactly the product itself says number 1, number 2. There's 1 through 12. The cell salts are numbered 1 through 12, and numbers 1, 2, and 12 are the ones that are good for teeth.
So like I have the one that has all 12 of them in together.
And you can do that as well. Yep. That one's a combo of everything.
Yeah. Mm-hmm.
Yep. And that's a great way to go as well. So they're easy to use. You just pop a couple of them underneath your tongue in the morning. You just put them out with the kids, same thing. They taste like nothing. No kid complains about taking these. So those are the things that I really recommend, along with, so that's internally. Right? That's adding minerals to the inside of you. And I also like to add minerals to the outside of the teeth. And the way you do that is with a toothpaste made of the thing that teeth are made of, which is called hydroxyapatite. So we're starting to get more products that have hydroxyapatite in it. So you want a toothpaste that has that, not fluoride. So there's a few brands. Boca is one, Risewell is one that a lot of people know. There's another called Carex. These are all brands that have a kid's flavor that most kids will like, and they have hydroxyapatite in it. This is the only thing I recommend for adults and kids alike. So no more fluoride. That's not what your teeth are deficient in. They're deficient in minerals. Let's deliver the minerals that the teeth are made of right to the teeth themselves.
Yeah, we're gonna have to go check.
Yeah, it's because we use a natural toothpaste, but I don't know if I was looking for.
It has charcoal in it. So
it has charcoal, and it's like bamboo, made with bamboo, but I've never.
So bamboo will have silica, so that's good because silica is actually something that'll help build your teeth. But yeah, make sure it has hydroxyapatite.
Yeah.
Okay.
Yep. So that's the prevention side of things. There's another piece that I really want to hit on with kids because it comes off of that. Putting us into that stress reaction place. So a lot of kids actually have airway and breathing issues, and you don't know it. So some of the signs to look for are grinding or clenching their teeth. A lot of kids have this. Some kids grind their teeth almost flat before their baby teeth are out.
And that is because of an airway issue?
It is, because what happens, so let's back up a little bit. When you are in deep sleep, the definition of deep sleep is paralysis. Muscles are completely paralyzed. So if you are in deep sleep, your muscles cannot move. You cannot grind your teeth. You cannot clench your teeth. You cannot roll around. You cannot do any of those things if you are truly in deep sleep, because muscles are paralyzed.
Never thought about it that way, but that's true. And so people who are grinding their teeth all night long are not actually
not in deep sleep. Exactly right. So why? What is the body doing? Well, one of the things that happens when those muscles paralyze is that airway. So all the muscles that hold the airway open that actually enable us to be able to breathe have to be on to be able to do that, right? So if the muscles paralyze and everything relaxes, including the tongue, all the muscles in the airway, everything collapses. If the airway is already obstructed, say they have really big tonsils because they've got some other infection, and there's a whole nother talk about that. But big tonsils, whatever it might be, and there's just not enough room once those muscles relax, then everything closes off. Well, you can't survive if you can't breathe. And this is a conversation for adults and children both. Okay. I'm going to focus on kids.
Manifest it in snoring.
This is manifested in snoring. You got it. Snoring and clenching and grinding teeth as well in an adult. So everything I'm saying can be extrapolated for an adult, which we focus a ton on also. But let's talk about the kiddos. So your body knows, okay, I've got a breather, I'm going to die. So it's going to wake you up to be able to breathe. And the first thing it will do is clench the teeth, because as soon as you clench the teeth, it will tighten the muscles and flatten the tongue, and air can get by easier. So clenching is a sign that your body's doing things to breathe. So if you're clenching or grinding, we know you're lacking in airway space. You're not getting enough air. So what will this show up as is in kids? This will show up as bedwetting, way past the years that they should be bedwetting. Why? Because when you are not getting enough oxygen, you build up ammonia in the system, which is a byproduct of carbon dioxide. You build up ammonia in the system. Ammonia is extremely irritating to the bladder. So if you have a buildup of ammonia in the system, the body will wake up and say, get rid of it. I can't stand this. And so you're going to get up and you're going to wet the bed. Or you get up and go to the bed. Mom just the other day said, well, my daughter gets up like 2 or 3 times a night to go to the bathroom. I said, oh my gosh. A child should never get up in the night to go to the bathroom. They should not do that till they're 87. Okay. So this is a huge sign that they're getting way too much ammonia, that they are not getting enough oxygen.
Kids at least waking up and not just peeing.
And not just wetting in the bed. Exactly. But if they're wetting, if a child is wetting the bed, this is most likely an airway issue. Focus, ADHD, attention issues, hugely related, because when the body, what I like to think of as deep sleep is construction mode. When you go to deep sleep, you are in construction mode. Your body is backing up the hardware, backing up the computer memory. It's storing memories. It is enabling the body to rebuild its hormones and its attention, the mechanisms it uses for attention. So if it never goes into that deep sleep mode, kids are running on empty. And they can't focus, they can't do whatever. So if you have somebody that, lots of focus issues, attention issues, you really need to look at sleeping and see if this child is sleeping correctly. Mouth breathing. If anyone's mouth breathing, adult or child alike, that is a sign that there's not enough air going through. So mouth breathing will cause, and a child will cause a lot of developmental changes, and will lead to an adult who's now has to mouth breathe and is now going to have sleep and other issues, usually related to fatigue, energy level, all those kinds of things in adulthood. So mouth breathing is definitely something that needs to be addressed as well. So what do you do about it, right? It oftentimes goes all the way back to day one. you heard of tongue ties and lip ties in a kiddo?
I've heard of the tongue. I don't know what a lip tie is.
Yeah, it's same thing. If you lift up the upper lip, you'll see that there's a tie there oftentimes. So what those ties do is they will affect efficiency of nursing or just drinking, of sucking. And if the tongue can't go up where it should and the lip can't come down where it should, the face actually develops in a different way and the tongue comes forward instead of back. A lot of changes happen and we see growth and development in the child being altered just because of some of these issues.
Like the jaw isn't big enough or something, right?
All of these things start happening. Yep. Mouth breathing, everything. And so often when we see a child who's not sleeping well, it goes all the way back to a tongue or lip tie that wasn't caught at birth. Nobody talked about, nobody knew. They were just really colicky as a baby. Nobody knew this could be related. So we actually reverse a lot of these development pieces. So we look at them, we say, okay, should we release these tongue and lip ties now? Yes, this is going to help. Okay. Along with that, we have to retrain the tongue to know what it should do. And we have to direct the growth of the jaw, just like you said. So there are appliances that we can start at age 2 even, but this can often prevent the need for braces. That's another sign too. if teeth are crooked, it means airways are insufficient. So this can prevent.
Is that meaning a baby teeth or is that meaning adult teeth? Like
adult teeth, both. If you have crooked baby teeth, even worse. There should be plenty of room for baby teeth.
Yeah, you don't really see baby teeth as crooked,
no, but adults. Yep. This is an airway. This is a jaw. This is a jaw discrepancy, a jaw size discrepancy. Mm-hmm. If there's not enough room for teeth, there's not enough room for air either.
Is it a genetic thing too, or no? Are you saying it's more a functional thing because of what's going on, or is it there's genetics in there as well?
So I back up and I say, what's genetic?
Right.
I bet you the tongue and lip tie is genetic. So yes, you're going to see it in families, but it's because the thing that causes the problem is inherited. So yeah, you're going to see genetic issues, but it's what were they inheriting? They were inheriting a tongue and lip tie. They were inheriting a jaw.
Like a tongue, say tongue tie. How far? Like, how do you? Is it just stick out your tongue as far as you can, and if it doesn't go out far enough, it's like there's an issue. Or how do you?
Great question. So you should be able to put the tongue to the roof of the mouth and open all the way and keep it up.
Oh, some people can't do that.
Some people can't do that. Oh. Look at hers. You need to look in the mirrors because she has one. You don't. Look at her tongue.
She does have one.
She has a tongue tie. You don't. See that band?
But yet I'm the one that snores and she doesn't.
Yeah. So yours isn't tongue tie related. It's probably other things related.
Well, I'll tell you, if I'm over a certain weight, it doesn't. It's a whole lot worse.
It's inflammation in the airway.
So you were saying that you have to go in and click that. I didn't even think that I really had one. You know?
Yep. And you don't have to clip it if there's no signs and symptoms, if you're fine. But in kiddos, we try to prevent those things from happening.
Well, so an interesting story. She was a bedwetter. Her dad actually invented that little machine, that alarm that goes off.
Interesting.
He did it because he was irritated because she was wetting
her.
So yeah, but that's he invented that whole thing.
It was called the nitone, and so it was very popular.
Interesting.
The very first one that was invented.
But so to kind of wrap it up a little bit, you're saying what's happening is because of the airway issue, they're not getting proper sleep. And because of proper sleep, they're not getting proper types of sleep, I should say. Yep. And because of that, that is part of the reason why these kids can have other issues like the bedwetting, the focus, the ADD type stuff.
Absolutely.
Yeah. See, I guess I've never correlated it to the sleep pattern.
Yep.
They can't get in the proper sleep. So their body and so you're saying because their mind can't go into that proper deep sleep rest, or if you want to say, right? Because that's why it's all continues going. Interesting. I didn't know. I never heard of that. I mean, I've heard lots of stuff on this kind of stuff, right? But I've never heard that as one of the possibilities.
Yeah, it's huge.
Awesome. So how do you get a 2-year-old to wear a stinking thing in their mouth?
So it's kind of like a chew toy, honestly. The one for a 2-year-old is, and you just have them chew on it, and what it does is it just directs the growth. So there are things to do. And obviously the conversation is much longer than what we have time for on what we do about it. But I just want parents to know that there's solutions, there's answers. If your child's suffering from some of these things, then let's talk. There's reasons and there's things that we can do about it. So that's pretty cool.
Oh yeah.
Yep,
So
go
were
ahead.
you gonna say more about it? Was there something else you were going to say
Oh,
about
that's it. So I was just gonna say those are the two prevention pieces that we really talk about: how to prevent cavities and how to prevent all these airway issues, airway and growth and development issues.
What percentage of kids would you say have an airway issue? Just like, is it a high percentage?
Higher than you'd thought. Higher than you'd think. I would say 15 to 20.
Wow.
So if you have 4 kids, you got one of them has it.
So Michelle, how can people get a hold of you then? Because I know that there's parents that are going to be listening to this and worried about their children and want to know what's
tell
the
us
next
about
step.
your office. Give us the information, the website information. We'll put it listed in below as well in the notes. But yeah, go ahead and give us your information.
So it's Total Care Dental. So it's totalcaredental.com. They can also check us out on all over social media accounts. We post all sorts of information. People are loving the information that we're sharing. So Total Care Dental Utah on Instagram, on Facebook, I think it's just Total Care Dental. You can go on YouTube. we have videos galore on there for all this information if you want more information. I think it's Total Care Dental Utah there as well. Phone number 801-756-3737, and I'm located in American Fork, Utah. We also do virtual consults. So I just did a virtual consult with a parent in Wisconsin this week who was really concerned about some of the things with their child. And so I can give a lot of advice and a lot of information and help with a lot of things, even just through virtual consultation. Like I said, it's called Total Care Kids, and my partner Lindy Jones and I run that. We also have 2 pediatric dentists that come and do any of our sedation procedures that we need in the office, because we do things differently too. We do, as far as if you need dental treatment, we do that different for children also. So we've really brought all those things in-house so that we can help kids and help them be healthy.
Well, that's cool. And it's always nice when you do a podcast and you actually learn something. So I've learned something.
Well, I'm glad I can teach a thing or two today.
Yeah, that's always incredible. So thanks. I know you got to run. You got a busy schedule. So thank you so much for your time. And thanks for being willing to be on the podcast, because we appreciate it. And we appreciate you being involved with our conference as well. And we'll talk to you more about that. But hey, thanks again. And anything else you want to say, Em?
No, but I just appreciate your time, because I know that our kids are important to us, and there's a lot of things that we just don't know what to do and how to find answers. So I think you really helped a lot, and now you gave us a direction of where to go to. So thank you.
Well, the more information you have, the better choices you can make, right?
Absolutely.
That's
I love
why
that.
we do what we do, right?
Love that.
Yeah, so Michelle, she will be at the conference. It's April 22nd and 23rd at the Mountain America Expo Center in Sandy, Utah. And you can come and hear her speak. And I don't know if Lindy will be there also, but
I might have to wrangle her to come with me.
it'll be great to hear and just get more information. So thank you. And thanks for joining us today and giving us a great education.
Excellent.
Thank you.
All right. Take care. Thank you.